I was really surprised actually. I didn't think I would enjoy it as much as I do.
You're like a big team, all of you all together.
We're not naive, it's not all rainbows and unicorns in life, but we do like to try and instil that whole family appearance really.
I'm happy to say I work for Medivet. I think we did a good job.
They were so friendly on my first day in the sports center that I was like, this is not real, this cannot be like this.
I worked for another big practice. I've also worked in a smaller practice where it was just myself and my boss. And I would say that there's a lot of Medivet that is unique. Our strategies, our approach to things, our approach to staff, our approach to our clients and our patients is unique.
I left for 6 months because I thought the grass was greener on the other side, but it's not. I just miss the clinical standards of everything. Everything is such a high standard and the patient care is gold standard.
All right, see you tomorrow. Thanks very much.
We have the hub and spoke system where we have the main centres and then we've got all the branches that feed into us. It's great for us and it's great for them as well because often it's young vets or vets that are specialised in a certain area and they want to give a full service, and it allows them to provide the best service to the owners, and they feel confident going back to the owners and discussing the case with them then.
Everybody actually gets the benefit of all this equipment that we couldn't really tangibly staff in every particular practice.
I think we're quite spoiled, like we get to have all the toys and all the gold standard stuff, so we're lucky.
So there are about 6 vets permanently at the hospital I trained in. I can always call them up and I can call our imaging guy if I don't know what's wrong with an x-ray, or I can call the medicine person if I'm stuck with a medical case. And all my more difficult surgery, so if a dog came in with a really bad fracture, I know our surgeon, I'll just go over and he can sort of walk me through it and say what he does, and I can build my skills up that way.
It's just such a network of people that we can follow our cases all the way through, and that's something that I think we take for granted sometimes.
If you have a difficult case, there's always like vets with more experience, so you can always discuss it, and it's still your case.
Just put Brevet. So Robert is joining our team here, so I've got to explain to him how we work so that he can then just slide in and perform just without stress, basically, not having all these things to worry about.
So it's been really pleasant being broken in slowly, watching a load of ops, meeting all the nurses rather than wandering around for 2 months going, I can't remember your name.
They've got so many opportunities for you to progress yourself higher and further, whether that's through being a nurse that works in the hospital, whether it's a nurse that works with the MRI or the CT that they've got in Hendon, or as a head nurse.
And it's easy to put yourself forward for training because they're happy to have anyone volunteer for training.
It's amazing that somewhere has their own college to cater for everybody, their own way of doing things, and it works so well.
They're all like my babies. I'm really proud of them all, yeah, definitely. And it's nice when they've left college and after a couple of years they appreciate what a good time it was.
I've worked in other places and I've worked in corporate group before. It wasn't horrible, but you just got on with your job. Here, it's much more of a kind of a community. Because a lot of people just finish work and they just want to go. Whereas here, we come into work early to hang out and then we leave work late. We're kind of sad in that respect, but it is fun.